Hey, good people, come on in, come on in. It's Tip Tuesday. I am donning my PPE, personal protective equipment, as we talk about coronavirus. So I know that's a hot topic among everybody, and I was going to steer clear of it, but I felt like y'all needed to hear some information, and you need to hear some information from somebody in healthcare, from somebody who can tell you some myths versus some truths, and to make sure that you can understand the difference. So come on in. Make sure you are sharing this video out with your family, with your friends. If you are watching me now, let me know if you can read this correctly. Tip Tuesday with Nikidra. Woo-hoo. Get excited. I actually had time to make our props. You know I love when I have time to make our props. So hey, let me know if you can read this correctly so that I can make sure that you all are getting the information. It took a lot of time to type these out, so I want to make sure you can read them and that they're not backwards. So in the comments, just let me know if you can read them correctly. I'm going to go ahead and get started. For those of you who don't know, my name is Nikidra Brown. I am the nurse practitioner who comes to you on Tuesdays with Tip Tuesday. You see, I'm donning some personal eyewear and some protective equipment because we're talking about coronavirus today. Many of you are probably thinking about it. You've heard it on the news over and over. So let's get rid of some of those myths and some of the things that you may have heard about coronavirus. All right, I got a couple of announcements. I am not a coronavirus expert. Let's make that clear. I am not a coronavirus expert. What I am is a family care provider, and I have seen people with coronavirus, and we are doing the screening process, and I am informed with what the CDC is telling us, so I'm going to pass that information on to you. Next, you want to make sure that you get your information from valid sources. So a lot of things that you all are sharing, these memes, stories, make sure they're from valid sources, CDC, World Health Organization, things that are credible, because you want to make sure you're giving factual information in times like these. So make sure your information is valid before you start just forwarding things and sharing it on your timeline, because you know once you see something on Facebook, it's word, right? All right, so 3, like, follow, share this video. If you don't know who I am, I'm Nikidra. We do this Tip Tuesday every Tuesday. If you like what you hear, make sure you follow me, you friend me, so that you can get the information every Tuesday as it relates to your health. And post in the comments. So I love for y'all to interact with me. Make sure as we go through that you post in the comments. I don't want to be talking to myself. I see a lot of you all joining, a lot of you all watching. So let's talk about corona or COVID-19. Probably the thing that you all never thought you would have to talk about, but let's talk about it. So, first question, is this a new virus? Put in the comments, is this a new virus? And we are all here to get educated. We're all here to get information. Don't be afraid of commenting. If you're watching this on replay, hashtag replay, so I'll know that you are watching this. And let's have some conversation in the comments. So, is this a new virus? That's the first thing I'm asking. If you're watching, be interactive. Put some information so that other people can learn. Is this a new virus? Comment below. While you're commenting, let me tell you that there is nothing new under the sun. There is nothing new under the sun. So that should help you with the answer to that question. We're going to get to it in just a few minutes. I see lots of you tuned in. Hello. I am Nikidra. Make sure you're sharing this out on your news feed. This is Tip Tuesday. I've got on some of my protective equipment because I'm a healthcare provider. We're all concerned with coronavirus. And I just want you to know what my new day-to-day is like. I typically would have this up, but this is the new day-to-day. So let's talk about epidemic versus pandemic. Epidemic versus pandemic. So an epidemic, that's affecting a large number of people in a population, community, or region at the same time. So when this started out in China, it was an epidemic. And y'all probably didn't even pay any attention because you were like, That's all the way over in China. What's it got to do with me? I'm just going to go on to work, continue sending the kids on to school, all that good stuff. So it was an epidemic when it was limited to China, and you probably didn't even pay it any attention. Now, it's a pandemic. It's occurring over a wide geographical area, and it's affecting a high proportion of the population. So how does it become a pandemic? How does it go from being just in China to actually being a pandemic? Hey, love you. How does it go from being just in China to go to being in pandemic? How did it come over to the United States? Let me know in the comments. Also, let me know where you are viewing from, because just like this can be viewed by people all over the country, all over the world. Put in the comments where you're watching us from, just so we can see how many people are actually affected by this conversation that we're having right now. That can give you some clue as to how things go from being an epidemic to being a pandemic. If you haven't already, make sure you're sharing this out. I'm clearing up some myths today about coronavirus. I'm tired of the memes. I'm tired of the misinformation. I'm tired of people not knowing what to do. There's some things y'all need to know and understand, and we're going to talk about them. I'm speaking really, really fast because I don't have much time, but I have a lot of information. So put in the comments where you are viewing this from. If you're watching on replay, hashtag replay. Let us know where you're watching this from as well, because we are talking about how things go from being an epidemic to being a pandemic. Right now, coronavirus is in a pandemic. So we are talking about why and how it can become a pandemic. I see people putting in the comments where you are viewing from. That's just so we can see how things travel. Travel is, yes, the big reason. People travel to and fro. The epidemic started in China, and now it's here. So let's talk about it. COVID-19. Healthcare professionals, we're calling it COVID-19 for short. You probably know it as coronavirus. COVID-19 is a coronavirus, and it affects the respiratory system. So it was first identified, it was epidemic in China in December of 2019. Hence the 19. I've heard many people saying what the 19 stands for. The 19 was because it was identified in 2019 in China. This was an outbreak of a new strand of an existing virus. It's a new strand of an existing virus. So before I asked you, is this a new virus? It is not a new virus, y'all. It's not new. There's nothing new under the sun. It's not a new virus. It is just an outbreak of a new strand called the novel coronavirus. This has affected several thousands of people in China. Several thousands of people in China. In the United States, we saw our first case where? We saw our first case in Washington State. So if you haven't already, in the comments, put where you're watching us from, because we're going to talk about some numbers that are here in the United States. But I want to show you how things go from an epidemic to a pandemic. And you can all help us, because you can tell us where you're watching this from, and we can just see how things travel. Much like this broadcast is traveling right now, that's how infections and diseases travel. So drop in the comments where you're watching this from. Now, news is changing minute by minute, but as last I looked, there were up to over 40 cases in North Carolina, Over 40 cases in North Carolina. Wake County has the highest number with 15. Mecklenburg has second highest with 7. It's caused school to be out for about 2 weeks. It's caused stores to be closed. It's caused businesses to change the way they operate. It's also causing, as last I heard, the governor is going to declare that restaurants can no longer eat inside. You can only do takeout. If you haven't heard that, that's coming. You cannot eat inside of a restaurant after 5 o'clock today. You can only pick up food and take out, and that is probably short-lived. So if you haven't already gotten some food, you should. Thanks to all who are tuning in, and let me know where you're tuning from. So it's starting to scale back. At first, you went into restaurants and you saw you had to sit at greater distances from people. Now you're seeing that you cannot eat inside in restaurants. And slowly, you might see that you cannot even take out in restaurants. That is just my prediction. Let's track the spread. These numbers are from yesterday, and remember, these numbers are fluid, which means they change based on statistics, based on those people who are reporting. But from yesterday, the total United States cases were 4,565. Remember, this is increasing minute by minute. The total deaths, 87. So do the math. We have identified 4,565 cases, only 87 deaths. I don't mean to say only as if those 87 deaths are not significant. I'm saying only because when you look at the proportion of people who actually have been diagnosed versus the actual people who have actually died, it kind of puts this thing in perspective, right? Washington State, that's where we identified our first case, 904 cases, and it has the most deaths at 48 deaths. California is next. We're on that West Coast with 557 cases, a total of 8 deaths. Again, that's at the time I saw this yesterday. And New York, we're moving to the East Coast, 967 cases with 10 deaths. Again, put in the comments. I see lots of people joining. I love it, love it, love it. We're having some interaction. I want you to put where you are watching this from in the comments, because just like Corona is spreading, we want to see how this news is spreading and how things can travel from one place to another. Make sure you are sharing this out on your news feed. So share so people can understand and get more information. Now, coronaviruses are not new. I want to make sure you understand this, and let's be clear. If you're just tuning in, yes, I do have on goggles, I have on a mask, and I do have on gloves. That's what is required from me as a healthcare provider to make sure that I am ensuring the safety of myself. And here's my gown for those of you who are watching. Coronavirus causes many of the typical respiratory infections that normally circulate in the United States. They are always here, y'all. They normally circulate in the United States, especially in the fall and the winter. Most people, probably the majority of you watching, most people will get infected with one or more common human coronaviruses in their lifetime. You probably already been infected, because most people will be infected by one or more. Remember, this is a new strand, which means there have been old strands around for a long period of time. One or more coronaviruses you will get infected with in your lifetime. It happens mostly when you're a child. So you know, when you take your child to the office and they have high fever and they're not eating, they're not drinking, they're like, it's viral. Just give it a few days and let it wear off. You take them back a few months later, fall, it's another virus. Just give them a few days and let it wear off. Coronavirus, y'all, they could have any number of viruses. They could have coronaviruses. This usually causes mild to moderate upper respiratory illnesses that's similar to a cold. Do we routinely test for this? Are they testing your child for a cold? Are they testing your child for a cold? When they come back and say, oh, your child has a virus, do you ask them, what type of virus is it? They probably test them for flu, and if it's not flu, they're like, it's some other virus, it will just run its course. Those other viruses, do we routinely test for rhinoviruses, which is in your nasal system and passages? Common colds. Do your child get tested for these? Absolutely not. And I just said that majority of children, the majority of you watching right now, you've had some strain of coronavirus, one or two of them in your lifetime. Have you ever been diagnosed? No. So why are you all up in arms because there's not enough testing, there are not enough supplies to check people for corona? That brings me to my next thing. Is there testing available for coronavirus? That should be a giveaway. While you're putting the answer to this question in the comments, if you have tuned in since I said it, make sure in the comments you let me know where you are watching this from. We're doing some of our own research and our own epidemic versus pandemic experimentation here. I am in Durham, North Carolina. I'm trying to see how far this is going to reach, so it can be sort of an experiment to see how diseases can travel. So if you're watching this, I like interaction. I want you to comment. Let us know where you're watching this from if you haven't already. I got to do a time check because y'all know I got to get back to work. So in the comments, let me know if or where you're watching this from. And here's our question. Is there testing available for coronavirus? Where's your work? Tell us your city and your state. So is there testing available for coronavirus? I saw some no's in the comments. I saw some yeses in the comments. So, yes, there is some testing available for coronavirus. So I just told you that there are viruses that you probably had it all the time. They aren't diagnosed. You have heard that there is some tests that can check for coronavirus, but you also heard that there's limited supply, right? So you've heard that, there aren't enough tests to go around. That's probably because we don't normally test for coronaviruses. So why would we have thousands and thousands and thousands upon thousands of tests for something that we don't normally test for? We would never use them. That's not wise use of your finances for an office to have just stuff that they would normally test for. So offices, hospitals wouldn't have thousands and thousands of tests on hand because they never thought they would need them until now. So yes, there are some tests that are available, but they are not readily available because we didn't know we need to test. And yes, we've already covered that. That is a different strand than the other strands. And so that brings us to our next dying question from people. What are some of the symptoms of coronavirus? And so I know also that you've heard about some symptoms, what to look out for. Put in the comments what you've heard some of these symptoms are. Put in the comments if you've heard what some of these symptoms are. I'll wait. You know I need some interaction. Hand is close to my face. I'll wait. What are some symptoms of the coronavirus? What would you see early on to make you suspect, I'm going to go to my doctor's office and see if I can get treated and tested for coronavirus? Have you ever asked us for that before? Here you go. Runny nose, headache, cough, sore throat, fever, generally feeling unwell. Do any of these sound familiar? Probably something your children have had when they were younger. Probably something that you have had before, right? Runny nose, headache, cough, sore throat, fever, and you generally just feel not well. The onset of symptoms after exposure can be from 2 to 14 days. So that's where we're getting this quarantine. 2 to 14 days, and it's spread through large droplets, which is why when I come into contact with patients, I'm going to put my goggles on so those droplets can't get in my eyes. I'm going to put my mask on. I'm also going to put my gown on, and I'm going to have my gloves on. Y'all are giving me lots and lots of good symptoms. I love it. So 2 to 14 days after you get exposed, you can start with symptoms, and this current strand of coronavirus is causing some lower respiratory tract illnesses, such as pneumonia, bronchitis. And so people with cardiopulmonary, heart and lung illnesses, weak immune system, infants, older adults, you need to be very, very careful. So that brings me to my soapbox. Let me step up on it. That's why I try to tell y'all to take care of your bodies, not just when there's coronavirus. I tell y'all to take care of your bodies all the time, so that when something like this hits, your body is there to protect you. Now, it is a harsh virus because it is a different strand and everybody's bodies respond differently. But if you protect your body before this, then it will help you during this. You got it? You got it. So we talked about sugar, we talked about low carb, we talked about stop smoking, drinking, get your weight under control, protect your heart. All that stuff I tell y'all every week. All that stuff I tell y'all every week, you should be doing it. All right. So how can you get coronavirus? I'm going to speed up super quick here. How can you get coronavirus? How can you get coronavirus? Again, if you are just hopping on, I need you to share this out in your news feed. We're talking in depth about coronavirus. If you didn't see the beginning of the broadcast, we started from where it started, epidemic, pandemic. I need you also to let me know where in the United States you are viewing this from, because we are trying to see if this can go from an epidemic where I am in Durham, North Carolina, to all over the country and beyond. So we're trying to see if we can turn this video from an epidemic to a pandemic. All right, so infected people must spread the virus. If you're not infected, you're not going to spread the virus, right? Which is why we're trying to get people who are not infected to stay home. We're trying to get people who are not infected to stay home with other people who aren't infected. So infected people must spread the virus. It's spread in the air by coughing, by sneezing, by close personal contact, touching hands, shaking hands, by touching an object or surface with the virus on it, and then you touch your mouth, you touch the doorknob, and then you sneeze and cover. You just infected yourself. You just infected yourself. Touching your mouth, nose, or eyes. So I've gotten my eyewear on for protection. I would pull my mask up. It covers my nose and my mouth so that I cannot get infected. And in rare case, fecal contamination. I know that's why y'all running out getting that toilet paper, because fecal contamination, you can get the coronavirus. Y'all were one up on me. One up on me. Let's talk about treatment. Treatment. If you're hopping in, make sure you're sharing this broadcast out. I'm talking about coronavirus, telling you some truth versus some myths, so we can get some education out in our communities to help stop the spread of this virus, so y'all can do what it is you need to do so that we can actually stop this pandemic. If you're watching this on replay, hashtag replay. And if you're just tuning in, you're going to have to watch the replay to get all the before information. Make sure you share this out. So, treatment. What is the treatment? So when they used to tell you your child has a virus, just take them home, what did they give you? What did they tell you? Because whatever they told you then, guess what? That's the same thing I'm going to tell you now. It's nothing fancy. There are no specific treatments for the illnesses caused by human coronaviruses. I just told y'all, you have gotten these viruses. Probably those of you watching now, you've had them before, right? There are no specific treatments for the illness. You just treat the symptoms. You got a fever? What do we say the symptoms were? Where is it? You got a headache? You take some Tylenol. You got a cough? You take some Robitussin. You got a sore throat? You use some throat lozenges. You got a fever? You take some Tylenol, ibuprofen. Most people will recover on their own. Most of you get better on your own, as you do with other respiratory viruses, common colds. However, the risk for post-viral complications is higher. We talked about there is a risk for pneumonia and bronchitis, but it's also that risk with the flu, right? How many people you know have had the flu and then got bronchitis, then got ear infection, then got pneumonia? They're all viruses. You risk getting post-viral complications that are bacterial. And let me just interject this. An antibiotic, don't come in and ask me for no antibiotic. Do not ask me for an antibiotic. It will not cure anything viral. I think I have squared that away, and you should know me well by now. Don't ask me for an antibiotic. It will not cure this virus. And that's why they send your child home with nothing but ibuprofen and Tylenol. All right? Is there a vaccine? I got to move quick, y'all. Is there a vaccine? Come on. Talk to me in the comments. Come on. Talk to me. Is there a vaccine? If you're watching this, make sure you let me know where you're watching this in the comments. Put where you are, because we're trying to see if this video can go from being epidemic to pandemic, much like the corona. Is there a vaccine? I don't see any answers yet. Is there a vaccine? No. There is not a vaccine. But let me ask you a hard question. Even if there were a vaccine, would you take it? Would you take it? Because I try to get y'all to get flu vaccines every year, right? I try to get y'all to get flu vaccines every year. No, I don't want to get a flu vaccine because I don't want to get sick. No, last time I got a flu vaccine, that thing made my arm hurt. No, you give me every excuse in the book why you don't want to get a flu vaccine. But all of a sudden, now you want a corona vaccine. Something that's never been tested, something that doesn't even exist, but you want to sign up for it. Okay, I'm going to let y'all have that one. So there is not a vaccine yet, but they are working on one. The last prediction I heard would say it would take many months, up to a year, even to get a corona vaccine. But if you want to be a part of that beta testing to get the first corona vaccine, I'm sure they got somewhere for y'all to sign up. But don't let me know about it because I'm not doing it, all right? So there is no vaccine. They are working on one. It takes many months to create that. Much like you don't get a flu vaccine, it's created from the year before. All right, y'all. Thanks for pausing for the call. So the flu vaccine is made based on the strands the year before. So because these are new strands of coronavirus and there's not a current vaccine, that's why they need time to create it. Right? Right. All right. So reporting of suspected or known coronavirus, it is mandatory. It is mandatory. So if you come here and I suspect you have coronavirus, donned in all my PPE and such, I got to put on this glove and this mask and this gown, and I suspect you have coronavirus, oh yeah, you getting reported. Oh, you getting reported because it is mandatory. It is mandatory by law. How do you think we got those numbers that I told y'all about earlier? Where do you think we get those numbers from? It is mandatory reporting. How do you think you know there was an outbreak in Target or at the Lego convention here in North Carolina, or even that it started in Washington? Mandatory. We have to report it because we try to contain the virus where we can, and when it becomes pandemic, that's when we realize, oh, there's a problem. There's been outbreaks here, there, and everywhere. Make sure you put in the comments where you're watching this from so we can see if we can get this video to become a pandemic. How do you protect yourself? I know y'all have heard it. Many of you say, oh, you should have been doing this all along. But let's face it, y'all don't. Let's face it, you don't. And you love hand sanitizer. Can we get back to soap and water? Can we get back to the good old days of soap and water? You need to wash your hands with soap and water for at least 20 seconds. Keep your hands out of your face. Stop touching your eyes and your nose and then putting your hands in your mouth. You want to avoid close contact with other people who are sick. And you can transfer the virus even if you don't know you have it. If everybody knew they had it, then nobody would get sick because you would just hopefully self-contain yourself. But actually, people who are unaware that they have the virus are still contagious. That's why social isolation is so helpful. Social isolation is so helpful because you get that 2 to 14 day period of time to exhibit symptoms after you become exposed. Yes, get back to that good old soap and water. I hope this has taught you nothing, if nothing else, than to use soap and water. Sanitizer just won't do in all cases. And this is one of them. Because y'all like Bath and Body Works smell good sanitizer. Oh, you like all this with all kinds of scents. Vanilla bean, apple, warm vanilla. That stuff ain't helping you with the coronavirus. That's not helping you with coronavirus. Okay, let me move on. How to protect others. If you have a cold or cold-like symptoms, then you need to stay at home. I need you in your house. stay at home. Why do you think the kids not in school? Because kids always got something running, always sneezing. Keep them kids at home. They're at home. Stay at home while you're sick. Avoid close contact with other people. You want to cover your nose and your mouth with a tissue. Tissue. You want to blow in the tissue when you sneeze. And when you finish blowing, it goes directly in the trash. Not on the table, not on the chair. You don't pass it to mama to throw away. You throw it in the trash. Bring the trash can beside you. Just have little containers for trash and tissue just all around your house and your school and your workplace. Just containers for trash and tissue. You want to clean and disinfect objects and surfaces. Clean and disinfect objects and surfaces. What y'all cleaning with? Something that smell good, I know too. What happened to that good old smell of Clorox? That good old smell of ammonia? That good old Lysol? What happened to those good old smells that you knew was disinfecting? All these aromas and smell goods that's supposed to be cleaning. Y'all better get back to that Clorox. Let me go check the Clorox aisle and see how much Clorox is back there. Get back to something that's going to disinfect. You want to clean the surfaces. Why do you want to clean the surfaces? Because the virus lives on surfaces. It loves human hosts, but it can live on surfaces. Again, you touch the doorknob, you cover your hand after touching the doorknob, and then you get it into your body. That's why, yes, I do have on my protective eyewear and my gloves, gowns. Y'all making me wear this with this pandemic, but it is for my safety, the protection of my family. I don't want to go home with viral illnesses and transmit it to those in the family. So, yes, what to do if you may be exposed or infected? What's the number one thing you can do? Most of y'all doing it right now. That's why I have so many viewers on right now. What's the number one thing you can do? I want somebody to tell me what is the number one thing you can do if you suspect you are infected, and it is not to go out and get testing. Because remember, you've had coronavirus before, not this strand. This too shall pass. North Carolina has not had any deaths from coronavirus as of yet. Praise God. We do have over 40 who have been diagnosed. But yes, stay at home. I need you in your house. Become at one with your home. Let us think about this being just a way for, I'm going to say God because I'm a believer. This is a way for God to bring y'all back into your homes. You spend too much time outside of your homes. The kids playing sports. You working all the time. You going here and going there. You doing this and everything else. Get back in your home. Sanitize your home. Wash your hands. Stay with your family. Enjoy family time. Get back in your Bible. Start praying. Doing the things that we should have done, that we used to do back in the good old days. How many coronaviruses did you hear about when you was over at grandma's house? All the cousins together. Y'all gathered all around, just spreading stuff. You ain't hear about no coronavirus. Get back in your Bible and your word. Understand that you need to stay at home. Remember, most people with coronavirus, you will recover. This too shall pass. There's no specific treatment for the virus, but if there are bacterial or post-viral complications, then yes, you do want to be seen. Those can be treated. You can do the following. You can take pain, fever medicines. You can use a humidifier. You remember how grandma used to always have that kettle on the stove with that warm mist? That's now a humidifier. You can buy those sorts of things. But if you don't have it, still it works. Drink plenty of liquids. Water is always plentiful. Just turn on your faucet, drink some water. Take medications to help with your cough. You want to stay at home and you need to rest. How many of you just had time to rest without having all hours of your day consumed? Taking the kids this place. I got to do this for work. I got to get up for this meeting. I have to run and do this for the church. I'm on this committee. I'm on this team. When was the last time you just had rest? This is a call for rest, for being in your homes, for reading, getting closer to your family. Getting back to those good old times and those good old ways. All right, we're getting to the end. What's the difference between self-monitoring and quarantine? Because a lot of y'all are saying quarantine, and I want you to hear what the difference between self-monitoring and quarantine really is. So self-monitoring means you are monitoring yourself. Don't come here for me to monitor you. Monitor yourself. Take your temperatures twice a day. Look for any cough, difficulty breathing. Shortness of breath and difficulty breathing is also another symptom. If you feel feverish, if you have cough, difficulty breathing during the self-monitoring period, make sure you isolate yourself. Make sure you call then your healthcare professional, maybe your local health department, wherever you are, what the protocol is at this time. I would start with your local PCP, then find out where they want you to go from there. They probably don't want you to come into their office, because remember, most places aren't testing, and if that's what you want or need, you probably need to go somewhere that is testing, which now is probably ERs, if that. Maybe health departments. You need to find out where testing is being done. Quarantine means separation of a person or a group of people reasonably thought to be exposed to a communicable disease, but not yet symptomatic, from others who have not been exposed. So you can prevent the spread of communicable diseases. So even though you're not symptomatic, we said you can still have been exposed 2 to 14 days. So I'm going to need you in quarantine, right? I'm going to need you in quarantine so that we can make sure that you are not going to exhibit any symptoms within that 14 days, okay? Now, lots of you have gotten some of this education for the first time. It is important that we educate ourselves and our community, that you stay mindful, that you do what you must. There are a lot of people watching who have worked with me in healthcare. I appreciate you all helping me to disseminate this to the masses. Make sure you share this out, y'all. You need to share, because people need to understand the basics, not just some numbers that you hear, the basics of what coronavirus is. And lastly, is a mask necessary? So these are the masks that I tend to have here. Is a mask necessary? Because I used to could use these, put these right out on the desk. And if people came in with cough, cold, thought they had a flu, they just grab one. Now, if I put a mask out on my desk, the whole box will be gone. The whole box will be gone. So patients who are symptomatic, they have fever, sore throat, runny nose, cough, shortness of breath, they should wear this face mask. It's just a simple mask, and it's to keep the droplets from coming through their nose and their mouth. Healthcare providers who are watching, when you are evaluating symptoms, you should use standard contact and droplet precautions. You need on your gloves. I think I got this turned around backwards. I'm going to just put it on like this. You need on your gown. You need on your mask. You need on your goggles or a face shield. So y'all see how this mask is covering my nose? It's got a tint here. So this is called an N95 mask, and it's prioritized if you have procedures. So if I'm trying to get a sample to check for the flu, I need to wear this mask. If I need to give you a breathing treatment, I need to wear this mask. If I need to swab your throat, see if you got strep, I need to be wearing this mask, because right now I don't know if you really in fact do have coronavirus. And it's hot in here. Whew. So trust me, I don't want to be wearing it. I am wearing an N95, and I have been wearing one now since it started, while I am giving care. So that's all I got for y'all today. I hope it has been helpful. If you haven't already, make sure you put in the comments where you are watching this from. I need you to like, I need you to share, I need you to friend and follow me so that you can get all this goodness on Tuesdays. I ran a little bit long today, I know, but this was information I had to get out to y'all, because you going crazy over Corona and you've already seen it before. So make sure, if you like this, you share it out on your news feed so we can get everybody updated, educated, and motivated to take care of themselves while they are self-isolating, while you all are at home. You're wondering why schools are closed. This is why. So I love you all. If you were just hopping in, you're going to need to watch me on replay. This has been a long broadcast, but I think it's one that is well worth it. How y'all feeling? So take care of yourselves. I'll see you back on next Tuesday for another Tip Tuesday.